let's talk about cancer not being genetic, because obviously people have been hypnotized by the medical profession into thinking that cancer is genetic. First of all, I want you to think about it. Why would we have a gene for cancer? If you are a subscriber to to evolution, if you believe in evolution, you believe in anthropology, then you believe in survival of the fittest. So having cancer and dying young from cancer is not the fittest. Okay? So this gene, if we did have a gene for cancer, it would have been gone by now. We've been around for a long time, over 1 million years. Why would we have a gene for cancer? It makes no sense. If you are someone who doesn't really look at science but believes in God, why would God give us a gene for cancer? For entertainment? Would he want to say, look, this is boring, I have to watch this drama, I might as well have some fun, let me throw in a few cancer genes, diabetic gene. Why would we have a gene? It makes no sense. So when we look at what they're really talking about, for example, Angelina Jolie with the BRCA genes, BRCA genes, BRCA1 and 2. What are they? Well, they're genes that they're basically repair. They're genes that produce a set of proteins to repair double-stranded DNA. That's what they do. So you can inherit one from your mother or your father, doesn't matter, and a man or a woman can get it. And but now, the other gene that you inherited from the other, we have 2 sets of chromosomes. The other one that you got from the other parent that didn't have it doesn't have that. So therefore, it's not, you don't really have that trait. You have that possibility, etc., that you're going to have a decreased function of your repair mechanism for double-stranded DNA. But to get full-blown, 100% BRCA, you need to get the other gene, the other one that you inherited, mutated during this lifetime. That's called a somatic inheritance. So you have an inherited gene, and then you need to have a somatic or a somatic mutation. So what do you have to do if you're born with one parent that gave you that thing? Well, you need to eat healthy and live a healthy life. Now, what do you need to do if you're not born with that and you don't have it? You need to eat healthy and live a healthy life. So it doesn't change. It doesn't change. By the way, that BRCA gene that Angelina Jolie was is so worried about that they actually got her to remove her ovaries and uterus and all that, and her breasts, all that, prophylactically. It also increases the risk of colon cancer and pancreatic cancer. And you can't have your pancreas removed, you can't have your colon removed, so she's still at great risk. So why have I just want you to understand the madness. It's madness. It's madness. So it's not the DNA. This is clear. This should not, you need to study this so that you can, because don't believe me, research it, study it, and come to understand, because it's an unnecessary fear. And the only reason this is being promoted is because now, based on this technology, they can design all of these targeted genetic therapies that are extremely expensive and, by the way, don't work. Okay? There's all this targeted therapy now. In fact, everywhere you look in oncology, you look at ASCO, American Society of Clinical Oncology, look at all their research, 80% is finding these targeted genetic therapies, and they're calling it immunotherapy, etc. And all it is a fancy chemotherapy. Has tremendous side effects and doesn't work any better